Chairman and Executive Director, Outspan Hospital and Medical College, Dr. Godfrey Kiruhe, the Board of Directors, the Principal, Deputy Principals, the Governor of Nyeri County, Members of Parliament, parents, relatives, and guardians, graduates, ladies and gentlemen. It is with great pleasure that I address the 11th graduation of the Outspan Medical College. Today, we confirm and witness conferment of certificates and diplomas to 353 graduates who have devoted the last few years to gaining skills in this profession. Serving in the medical profession, as you all know, is a calling. I'm sized of the hard work and sacrifice that has gone into the Outspan Medical College from its humble beginning in 2009. You have graduated over 2,800 students. This is no mean feat. Honorable guests, ladies and gentlemen, I want to take this opportunity to all the graduates to say congratulations. In line with the graduation theme, a global approach to healthcare training, I commend the Board of Directors and the management of Outspan Hospital and Medical College for building both institutions. The hospital gives the students first-hand experience in the 10 courses. Indeed, the practical bit is what we have been looking for as a government to blend knowledge and skills for our students in the technical and vocational education and training centers, TVETs. That is what will carve learners to be more job creators, not seekers. Nimesikia wale wakisema wamepata kazi ya kutafuta kazi. As a registered TVET institution, Outspan Medical College, therefore, is a confirmation of your alignment with the government agenda of strengthening the middle-level colleges in response to market demands. On this note, I also commend you for seeking accreditation to offer degrees as a chartered university by 2026. We wish you well and look forward to celebrating this new milestone with you. Honorable guests, ladies and gentlemen, graduates, we hold this ceremony against the backdrop of COVID-19 and a sharp rise of mortalities related to non-communicable diseases like cancer, the third leading cause of death after infectious and cardiovascular diseases in Kenya. On the other hand, infectious diseases and injuries account for more than 50% mortalities, where non-communicable diseases contribute to at least 39.6% of deaths. Although COVID-19 rages on a smaller scale, we have learned that we need more medical practitioners, including researchers, if we must remain healthy despite the pandemics, epidemics, and other diseases. And as we move to economically transform the country, we recognize that a healthy nation is a wealthy nation. Honorable guests, ladies and gentlemen, graduates, Kenya cannot be a wealthy nation when our health facilities are dilapidated. Kenya cannot be a wealthy nation when we do not have enough skilled medical workforce. As of 2020, we had 189,000 health workers, 66% of them being in the public sector. At least 58% were nurses, 13% clinical officers, and 7% medical doctors. The World Health Organization recommends 25 nurses for every 10,000 people. We have 8.2 nurses serving 10,000 people. As a government, we have committed to transform the health system for quality, affordability, and accessibility as per the standards of the World Health Organization. That is why we have made it deliberate to work with the private sector and other actors to improve quality and access to healthcare services as conceived under the Kenya Health Policy 2014 to 2030 and the Kenya Kwanza Manifesto, the plan. We are also working with other actors to improve training to the highest attainable standards. Honorable guests, ladies and gentlemen, in this regard, our administration has prioritized investment in health. Progressively, we'll strive to increase the national annual budget allocation to 15% as per the Abuja Declaration by the African Union member states. We'll continue creating an enabling environment to encourage investment in health by the private sector to complement our efforts towards delivering universal health care as per our manifesto. That is why the graduates here today and those who will graduate from other institutions this year will be central as we roll the universal health coverage across the country. Reforming the NHIF system is also ongoing to ensure we cover everyone, including vulnerable groups like the old, people living with disabilities, among others. Honorable guests, ladies and gentlemen, graduates, allow me to also recognize the critical role of county governments in delivering health services to the grassroots. As per our plan, we will continue increasing funding to enable them to meet the healthcare needs of our people. We encourage them to hire qualified and competent personnel, provide better remuneration, as well as ensure prudent use of public funds. Improving our healthcare system will transform Kenya into a strategic regional player in this sector in East African region. This is how we'll tap more from the over 472 million population in the region through first-class and specialized services. Honorable guests, ladies and gentlemen, as for the graduates, you have been given the power to read and write. The graduation today is the beginning of more reading and professional growth. The limit is no longer the sky, but you. As I conclude, allow me to challenge you to advance your skills beyond the diplomas that will be conferred today. Hongera sana, asanteni sana na Mungu awabariki.